Absolute humidity is the amount of water vapor in the air divided by the amount of dry air. Water vapor is the gaseous state of water and is invisible. The hotter the air is, the more water vapor it can hold. Relative humidity is the most commonly used term regarding humidity. Expressed as a percent, relative humidity measures the current absolute humidity compared to what the air can hold at that temperature. The heat index is a value that combines air temperature and relative humidity. The heat index, sometimes referred to as the apparent temperature, is a measure of how hot it really feels when relative humidity is factored in with the actual air temperature. Saturation is the presence of the most water vapor possible in the air at a given temperature and pressure. A psychrometric chart is utilized to determine many of these factors and is an easy way to see the relationship between water vapor, air temperature, and barometric pressure. Workers exposed to hot indoor environments or hot and humid conditions outdoors are at risk of heat-related illness, especially those doing heavy work tasks or using bulky or non-breathable protective clothing and equipment. Firefighters, construction workers, and maintenance personnel are at extreme risk. Some workers might be at greater risk than others if they have not built up a tolerance to hot work conditions, or if they have certain health conditions. The summer months are especially hot, and the risk of suffering from heat stress is greater for any worker who works outside. It is possible for anyone to suffer from heat stress, whether working inside or out. You must act quickly if you notice any signs or symptoms of heat stress on yourself or fellow workers. The human body must maintain a constant internal core temperature of approximately 98.6 degrees Fahrenheit. The body works naturally to maintain this temperature by generating heat, absorbing heat from the environment, and releasing heat as needed. Environmental sources of heat include the ambient or surrounding air, sunlight, direct light, machinery and equipment, to name a few. The body releases heat by varying the rate of blood circulation to and from the blood vessels near the extremities of the body. The blood carries heat from the body to the widened vessels near the body's surface, where it is released into the cooler atmosphere by one or more of the following ways. Radiation is when the body heat simply transfers to the air surrounding the body. Radiation cooling is most effective at air temperatures below 80 degrees Fahrenheit. Convection is when heat is carried away by cooler air which passes over the skin, such as a fan blowing over the body. As with radiation, convection is most effective at temperatures below 80 degrees Fahrenheit. Evaporation is when water liquid or sweat is released from the sweat glands to the surface of the skin. Heat from the body changes the sweat into water vapor, which then evaporates in the warm, dry air. This process is also known as a phase change, and it has a tremendous cooling effect on the body's temperature. Evaporation usually begins when the air temperature is greater than 80 degrees Fahrenheit. Not all sweat has time to evaporate, though, and much of it tends to run off the body, which does not evaporate, thus not cooling. When it is extremely hot and humid, the body's ability to cool itself is affected. At air temperatures lower than 80 degrees Fahrenheit, radiation and convection are very effective methods of removing body heat. Once the air temperature reaches 80 degrees Fahrenheit, those methods begin to lose their ability to properly cool the body. At 95 degrees Fahrenheit, heat loss by radiation and convection stops completely. At this point, heat loss by sweating becomes extremely important. Sweating without phase change does nothing to cool the body. Sweating is only effective if the humidity level is low enough to allow evaporation of water vapor into the air. As the humidity level increases, the amount of water vapor in the air increases. This decreases the room available for sweat to evaporate. It is also important for fluids and salt lost during sweating to be constantly replaced, or dehydration can quickly occur. When the body heats too quickly to cool itself, and/or when too much fluid or salt is lost through sweating or dehydration, the body starts to store the excess heat. The core body temperature rises above 98.6, and the heart rate begins to increase. This is heat stress. The stress brought on the body by the excessive heat causes different symptoms commonly referred to as heat-related illness. These illnesses range from heat rash to heat exhaustion to heat stroke. Heat stroke is a very dangerous condition. It can result in death and requires immediate medical help. Exposure to excessive heat can also increase the risk of injuries because of sweaty palms, foggy safety glasses, dizziness, and burns from hot surfaces or steam. Some risk factors of excessive body heat and stress include high air temperature and humidity, direct sun exposure, lack of airflow due to no breeze, wind, or ventilation, radiant heat which radiates from a piece of equipment heating the body. Boilers, furnaces, and other hot production machinery and equipment can radiate a tremendous amount of heat. Physical exertion creates heat known as metabolic heat. The more strenuous the work, the more heat is produced. Bulky or non-breathable personal protective equipment. Little or no acclimation period to a hot work environment. Poor physical condition or health problems. Prescription drug and alcohol use. Age. Previous heat-related illness. Sunburn, which can greatly retard the skin's ability to release heat. Excessive and continuous exposure to heat stress can lead to a wide range of heat-related illnesses. Generally, symptoms start out mild and can rapidly get worse if not treated. Tolerance to heat stress varies from worker to worker, but usually all workers will exhibit some reduced mental and physical performance as they become affected. As stated earlier, exposure to high heat can also increase the risk of injuries. Some of the most common heat-related illnesses are heat rash, heat cramps, heat syncope or fainting, heat exhaustion, and heat stroke. Heat rash is the most common problem and is also known as prickly heat. It appears on the skin as a red cluster of pimples or small blisters and is caused by sweating. Normally, it appears on the neck, upper chest, groin, under the breast, and in elbow creases. The best treatment is to provide a cooler, less humid work area. Keep the rash dry and use powder to provide comfort. Do not use creams or ointments that make the skin moist and warm. Heat cramps are muscle pains usually due to physical work in hot environments. Heat cramps are caused by the loss of salt and fluids during sweating. Usually the cramps occur in the legs, abdomen, and arms. If you get heat cramps, you should stop work activity and replace fluid loss. Relax and sit in a cool place and drink water and/or sports drinks, which replace electrolytes. Avoid strenuous work for a couple of hours until the cramps have totally subsided. Heat syncope is a fainting episode or dizziness that usually occurs with prolonged standing or sudden rising from a sitting or lying position. Factors that may contribute to heat syncope include dehydration and lack of acclimatization. Sit or lie down in a cool place and drink water, clear juice, or a sports drink. Heat exhaustion is one step away from heat stroke. It is due to a large loss of liquids and salt because of excessive sweating. Symptoms of heat exhaustion include heavy sweating, headache, nausea, vomiting, dizziness, weakness, irritability, confusion, thirst, and a body temperature greater than 100.4 degrees Fahrenheit. Treating heat exhaustion is important because if not treated, it could lead to heat stroke, which can be life-threatening. Move to a cool place inside or in the shade. lie down and loosen clothing. Drink cool water or, if available, some type of sports drink. Avoid caffeine and alcohol, as these types of fluids will make the condition worse. Eating a salty food such as a saltine is beneficial if available. Massage and stretch your muscles. Take a cool bath or shower. If a person is experiencing vomiting or fainting, or if after 30 minutes of treatment there is no relief, medical help should be contacted immediately. Heat stroke is the most serious heat-related health illness. Heat stroke is very dangerous and can cause organ or brain damage and even death. Usually, heat stroke progresses from a milder condition such as heat exhaustion and is generally brought about by an extremely high heat index and dehydration. It can occur when the body's temperature regulating system fails and the body temperature rises to 105 degrees Fahrenheit or higher. The symptoms of heat stroke are confusion, loss of consciousness, seizures, slurred speech, and a throbbing headache. Skin may be hot and dry or could be sweating profusely. Heat stroke is a medical emergency which could result in death. Call 911 and get trained medical help to the individual immediately. Until medical help arrives, move the worker to a cool spot in the shade or an air-conditioned building and remove as much clothing as possible. Soak the victim with cool water from a garden hose or other source and fan the air around them. Apply ice packs to the neck, armpits, and groin area to assist the body in cooling down. Provide sips of cool water or other non-alcoholic beverage if the person is able to drink it. The risk of heat-related illness becomes greater for outdoor workers as the weather gets hotter and more humid. For people working outdoors in hot weather, both air temperature and humidity affect how hot they feel. The higher the heat index, the hotter the temperature feels, since the body's sweat does not readily evaporate and cool the skin. The heat index is a better measure than air temperature alone for estimating the risk to workers from environmental heat sources. The heat index can be used to help determine what actions are needed to protect workers and when those actions are triggered. It does not account for certain conditions that contribute additional risk, such as physical exertion and wearing heavy or protective clothing. Also, working in direct sunlight can add up to 15 degrees Fahrenheit to the heat index value. Most heat-related problems can be avoided and the risk of developing them reduced. Instead of having to respond to a heat-related medical emergency, it is best to evaluate all jobs for possible heat stress risk and then take appropriate action to minimize the risk. This can be accomplished through engineering controls, work practices, or administrative controls and PPE. Engineering controls. The best way to prevent heat-related illness is to try and make the work environment cooler. When working outdoors, schedule work activities during the cooler part of the day, such as early mornings if possible. Have workers take frequent breaks and provide shaded areas close to the work site. Tents can provide some shade from the sun. Provide air-conditioned areas close to the work site, such as trailers for lunch breaks and other breaks. Use equipment that has air-conditioned cabs when possible. Reduce workloads through scheduling. And always encourage the use of power tools and machinery to reduce physical exertion. When working inside, have air-conditioned areas for breaks. If possible, air-condition the entire work area. Utilize fans and ventilation systems to increase airflow in the overall area. Portable cooling fans can provide relief to certain areas or individuals. In high heat areas, such as around production equipment, the use of specialized exhaust ventilation systems to remove heat or moisture is recommended. Finally, using reflective shields can help redirect radiant heat along with proper insulation. Work practices or administrative controls. There are work practices which should be in place for workers to follow. As an employee, You should take heat stress seriously and do what you can to protect your health as well as your coworkers. The first and best step is to be trained about the dangers of excessive heat and humidity and ways to avoid heat stress. It is also important to have an acclimation period of at least 5 days to allow the body to adjust to the hot work environment. New workers and those returning from an absence of 2 weeks or more should have at a minimum a 5-day acclimation period. While a significant amount of acclimatization occurs rapidly in that first week, full acclimatization may take a little longer. Some workers require up to 2 or 3 weeks to fully acclimatize. An ample supply of cool drinking water should be available at all times. Workers must drink water throughout the day to keep their body hydrated. During moderate work levels in moderate heat conditions, a worker would need at least 1 pint of water per hour. It is best to drink a 6-ounce cup of water about every 15 minutes. Urine should be clear or lightly colored. Be aware it is harmful to drink excessive amounts of water. Workers should generally not drink more than 12 quarts of fluid in 24 hours. Always avoid alcohol and drinks with large amounts of sugar and caffeine in them. Check weather forecasts daily to be better prepared. Schedule jobs with high heat exposure to cooler times of the day or even different times of the year, if possible. Routine maintenance and repair tasks could generally be scheduled during cooler seasons. Wear light-colored, loose-fitting clothing made from cotton. Do not wear clothing made from non-breathing synthetic material. Personal protective equipment. The use of some PPE, such as certain types of respirators and fire-resistant clothing, can increase the risk of heat stress. Workers should be monitored by establishing a routine to periodically check them for signs of overexposure. In other situations, special cooling devices can protect workers in hot environments. Some examples of heat protection PPE include insulated gloves, insulated suits, reflective clothing, infrared reflecting face shields, thermally conditioned clothing,